A type of flesh-eating bacteria is on the rise, and it has officials with the CDC sounding the alarm. The bacteria is called Vibrio vulnificus. And doctors are seeing an increase in infections in states along the East Coast. There have been at least 5 deaths from the infection in Connecticut, New York, and North Carolina. People with open wounds, recent piercings, or new tattoos are more likely to contract it. And there's a new wave of COVID-19 infections in the U.S., but it is tricky to track. That's because the federal government has stopped recording cases and many people are now testing at home. Officials monitor the spread of the virus by analyzing wastewater and looking at virus-related hospitalization rates. In the last 2 weeks, hospitalizations have gone up by 31%, yet they're far from the peak reached during the height of the pandemic. There's a reported uptick in COVID via wastewater surveillance, particularly in the West and also in the Northeast. Experts say the current wave of infections are likely being driven by older strains, not the newly identified BA.2.86 variant. That's the latest variant. And joining me now to talk more about all of this is Dr. Marni Gandhi, professor of medicine and associate chief of the Division of HIV, Infectious Diseases, and Global Medicine at UCSF. Dr. Gandhi, it's always good to see you. I haven't seen you in a while. I was thinking about you last week because, like so many of my friends, have been getting COVID again. It seems like everybody's getting it, but it doesn't obviously seem as serious. People seem to get over it faster. Is that because so many people are vaccinated, or what's sort of going on with COVID right now?
Yeah, I mean, we are at our highest point of population immunity than we've ever had in this country. It's not just vaccination, but a lot of people have been infected before. So the CDC estimated that 96.4% of us had immunity to this virus by November 2022, and there were waves since then. So there's just a lot of immunity that keeps the severe disease low. So people are getting it like we used to get a lot of colds and the flu, but there's much lower rates of severe disease. And our hospitalizations are low. Those who are still at risk for hospitalizations, like you just said, are older people or those on immunosuppressants. And there's a new booster coming out probably in a week, mid-September, for those populations.
If you're not immunocompromised, I mean, should we still be getting these boosters, Dr. Gandhi, or can we just kind of move on at this point?
It's a really good question. The CDC is meeting on September 12th, so very soon, to talk about that very question. Are they going to recommend everyone gets it, or just older populations and those on immunosuppressants? I will say the rest of the world has gone with the latter recommendation. So the World Health Organization, the UK, countries in Europe, they all say, well, at this point, we're going to all be infected. Probably we're all going to have our vaccines under our belt. And at this point, they're only going to recommend the booster, the rest of the world, for older populations, those on immunosuppressants. So I actually hope the CDC aligns with that, because we had a low uptake of the bivalent booster in the past because they were using a one-size-fits-all message. Now this is the time to really figure out who's still at risk for severe disease and protect those populations. Those are older on immunosuppressants. Also, they need Paxlovid, a medication.
Interesting. Good advice. Okay, another story I want to get your input on right now, Dr. Gandhi. Virginia is experiencing an outbreak of meningococcal, I think that's how you say it, you'll have to correct me, disease. Health officials say most of the people impacted are Black or African American between 30 and 60 years old. The disease is rare but very serious. Since June of 2022, there have been 27 cases in the state of Virginia. Department of Health says that the number is 3 times higher than the expected number of cases. 26 of the 27 patients were not vaccinated against that bacteria that causes the disease. At least 5 people have died in the outbreak. I mean, is this something we should be really worried about, or should the people there be concerned, do you think?
Well, it's restricted right now to the state, but what this is N. meningitis or Neisseria meningitis can rarely cause outbreaks of meningitis. It really is meningococcus causing inflammation of the lining around the brain. And this is definitely unexpected in the sense that these are more cases than we usually see. It turns out there is a vaccine for meningitis. It doesn't cover one of the strains, but it covers the strain that is causing this outbreak.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.